Hi, everybody. My name is Andrew, and I will be providing a brief journal club presentation on an article titled AI for Science Predicting Infectious Diseases by Zhao et al. I hope you find it both enjoyable and informative. The emergence and re-emergence of infectious disease is a continuous global health challenge with widespread impact. Outbreaks of infectious disease typically result in high levels of morbidity and mortality, economic and social disarray, and strain on healthcare infrastructure around the world. Within the chaos, however, outbreaks are also catalysts for perpetuating scientific research, new treatment practices, and epidemiological innovation aimed at predicting and ultimately preventing future occurrences. These ventures often require collaborative efforts from professionals and agencies of various disciplines on a global scale. One such example of this advancement is what will be discussed in detail throughout this presentation, utilizing artificial intelligence, or AI, to facilitate, enhance, and accelerate scientific discovery with the goal of preventing global infectious disease. The journal being reviewed was written by Zhao et al. And was published in the Journal of Safety Science and Resilience in 2024. Most of the contributing authors have engineering backgrounds, particularly electrical engineering, and one has a background in business. I found it interesting that a group of professionals with no expertise in public health or healthcare dove into a topic like this. Given the nature of artificial intelligence and automation, however, individuals with this type of background would be critical elements in study approach, design, and implementation from a unique perspective. This work also serves as a testament to the importance of interdisciplinary collaboration to meet goals for the greater good. Traditional epidemiological models of tracking and predicting disease are primarily based in mathematical principles and are greatly influenced by the SIR model, a model proposed in the 1920s that compartmentalized populations into categories of susceptible, infected, and recovered. This framework laid a foundation for later prediction models such as the SEIR, which added in the exposed compartment, the SIS, or susceptible infection susceptible model for diseases that did not have long-lasting immunity, and age-structured models that predict disease susceptibility based on age. These models proved effective in their own right, but were limited in their power to handle large quantities of data and rapidly changing variables in a timely, efficient manner. Thus, there is a need for improvement and incorporation of a tool like AI for science, something that is really meant to take things a step further and transcend what traditional models can provide for research and epidemiology. AI for science in this context is meant to take in data from diverse sources and efficiently predict, monitor, and respond to disease outbreaks around the world. The primary purpose of the article being reviewed is to introduce a prospective framework for incorporating AI for science aimed at precise disease surveillance and outbreak prediction. In doing so, the authors also discuss critical limitations and ethical considerations associated with utilizing this technology, while also drawing on historical outbreaks that articulate the need for a tool like AI. That being said, the journal is essentially an overview of the framework and where AI would fit into each element, followed by a discussion of limitations. There are no participants, data analytics, or formal results presented in this article. The upcoming slides will discuss each component of the proposed framework and highlight the author's intentions for incorporating AI technology for analyzing relevant data and providing unique insights into public health and epidemiological practice. In order for AI to effectively predict infectious diseases, it requires vast amounts of information from diverse data sources, including satellite imaging, social media, health records, travel and mobility data, and genomic and pathogen data. Satellite imagery provides consistent, objective data about the Earth's surface to monitor environmental and climate patterns that can change over time, changes that may promote things like bacterial growth or influence the life cycles of vector populations and their ability to spread disease. Social media platforms are critical, widespread sources of instantaneous user data for AI to analyze and recognize patterns within discussions and posts around the world that may indicate disease spikes in a given region. In the digital age, electronic health records make it easy for AI to manage more random, unstructured data pertaining to global health trends to predict an increasing risk of an outbreak. Using information from sources like flight records and immigration, AI can be used to track the movements of populations and the infectious diseases that could potentially move with them, allowing for the prediction of potential hotspots of disease. Finally, AI is capable of sequencing entire genomes of infectious disease agents to analyze and predict their virulent capabilities, potential resistance to drugs, and transmission patterns to better understand pathogens and work to create more targeted interventions. In public health, having access to data in real time allows for interventions to stay relevant and ensure their efficacy. AI systems are capable of taking in and analyzing large amounts of health data in real time to recognize patterns and put out alerts immediately when notable trends are identified. An important component to this surveillance is the ability to track atypical occurrences or anomalies that may raise a red flag if there is enough data deeming it so. The role of AI here is to recognize these anomalies to give experts ample lead time to investigate prior to an outbreak while limiting any false alarms by automatically adjusting known thresholds of disease transmission dynamics. Sentiment analysis is critical for reading into data from people, such as through social media, and allows for AI to determine the emotion behind words to inference any social indicators of disease at an early stage. Lastly, as mentioned in the previous slide, genomic sequencing of pathogen genomes is helpful for identifying and tracking potential resistance to drugs and any changing transmission patterns to better understand pathogens and work to create more targeted public health interventions. AI systems are capable of taking on these impacted, data-heavy tasks and presenting timely warnings before outbreaks can occur. When considering disease spread, real-world interactions are important considerations. AI systems can generate structured models of the interactions and relationships of individuals that can be used to predict pathways of potential disease spread and the potential for hotspot development. Similarly, mobility data can be analyzed by AI to consider factors like migration and general travel patterns to predict the possibility of superspreader events and venues. Demographic data is another important predictor, since it is well established that disease susceptibility can be associated with factors such as age, gender, race, and ethnicity. Analyzing this component with AI would compartmentalize risk factors linked to demographic information and help create targeted interventions aimed at these predispositions. The same can be said about socioeconomic factors and socioeconomic status in the sense that greater vulnerability to disease is connected to those living in impoverished communities. Predictions made by analyzing climate change patterns can provide an edge in anticipating areas that potentially have more breeding sites for vectors and allow for harmful pathogens to thrive. AI systems can also make predictions using simulations, during which what-if scenarios are created to test the effectiveness of intervention strategies and adjust whatever elements may need improvement to yield the most favorable outcome in an outbreak situation. Deep learning is a common technique used by AI software that is centered around capturing nonlinear relationships. What this means is that each layer within the networks that promote deep learning processes and analyzes data before passing it along to the next, allowing the system to make sense of what is being presented. This is helpful when analyzing something unstructured like medical images and detect subtle patterns that may indicate early-stage disease. This is also the heart of what allows the system to analyze multiple, complex sets of unrelated data and make sense of it, such as combining climate data with social media trends to predict a potential outbreak. Reinforcement learning is based on the behavioral psychology concept of a reward-punishment system, in which a certain action will either yield a positive or negative result. AI utilizes reinforcement learning similar to the previously discussed simulation monitoring, in which intervention strategies are tested to learn what the most favorable outcome would be. This can be helpful for optimizing intervention strategies and simulating drug compounds with biological systems to create new medications. A time series analysis is useful for recognizing temporal patterns in disease prevalence, for example, flu season, and knowing how to plan ahead when it comes to resource and treatment planning and allocation. Bayesian networks are concerned with uncertainty or abnormalities and attempt to draw connections to potential contributing factors, such as a disease spreading that might be contingent on environmental or community factors. Lastly, geospatial analysis allows for bridging geographical makeup and disease dynamics. For example, AI systems can utilize data from satellite imaging and mobility patterns to create algorithms that identify other regions that may have higher risk of disease based on similar geographical features and regional outbreaks. Backtesting is the process of applying proposed models of disease prediction to historical outbreaks of the past. This would be helpful in testing the reliability of a generated model, and that a similar outcome from a previous event would mean that the method of prediction is effective. Coupled with this is the ability to make necessary adjustments to prediction models in real time to allow for the most current variables to always be considered. When comparing AI for science to traditional models, they each have their pros and cons. Traditional models are usually a lot simpler and are often a lot more clear, but they have more fixated variables until they're manually updated, leaving room to not capture all diseases and any of the associated contexts. AI models, on the other hand, are very powerful and can process vast amounts of new data at all times, but are prone to overfitting and misinterpretation depending on the data it is being fed. Feedback loops are useful tests to further enhance machine learning, as each resulting output is put back into the model to test for validity and see if anything changes. If changes are merited, AI systems can automatically adjust variables to refine its algorithms, whereas traditional models need to be manually recalibrated to account for any changes. As is the case with any venture, using AI for predicting infectious diseases is not without limitations. First is the quality of the data being analyzed. Gaps can always occur in the data that is made available to the AI system, such as the quality and frequency of images from satellites that would be contingent on the satellite's capabilities and the region it is surveying. When considering social media analysis, for example, excess information unrelated to health and disease could create difficulties in filtering out any meaningful insights to predict any outbreak concerns. Any variation in data collection methods can also skew data and introduce biases into AI prediction models. When considering technical limitations, too much deep learning runs the risk of overfitting results. In other words, the system would be trying exceptionally hard to yield expected results, making them unrealistic and unreliable. And while AI can handle large quantities of data, any low quality and low accuracy data in itself introduces a risk of unreliable and skewed interpretation by the system. Socioeconomic limitations include the public's perception of relying too much on AI and a fear of its capabilities. With this also stems the concern of consent for the incredible amount of data required, including personal health data, and it being made available for AI to analyze. Lastly, the limitation of the technology itself is important to consider. Without the necessary computational and electrical power to run this level of work, all of this is merely an idea. Even if this was adopted for large-scale use, some would consider it invasive on the existing healthcare infrastructure and could potentially make healthcare staffing obsolete. To conclude, the authors demonstrate that AI for scientific applications can play an innovative and transcending role in predicting infectious diseases worldwide. AI systems are capable of analyzing complex datasets from diverse sources with ease and accuracy to predict when and where outbreaks of disease are most likely to occur. There are challenges that must be considered when applying this framework to public health and epidemiological practices. However, through continued refinement of the framework and the variables at work, incorporating AI for science can provide an enhanced comprehension of disease dynamics and give experts an advantage to prepare and respond effectively to future global health challenges. Thank you all for taking the time to watch my presentation on AI for science and disease prediction. The following questions are meant to serve as some points of further discussion. 1. What are some key challenges in scaling AI for science for global health applications, particularly in resource-limited settings? 2. How can interdisciplinary collaboration between various professionals and community stakeholders enhance the utility of AI in disease prediction? And 3. What are other potential sources of data that can be used by AI to predict infectious disease? Looking forward to hearing your response. Thanks again.